I did promise you an exclusive one-on-one interview with Anita Nkonge with the CAS in the Ministry of Health, that is Mercy Mwangangi, on vaccines. I'm sure you're curious how and when they will be administered in Kenya. Here is that interview.
The Ministry of Health says 40% of the population will be vaccinated through the National Vaccination Program. The vaccination exercise will cover the 40% of the population in 3 phases.
Phase 1 will involve vaccinating about 1.25 million Kenyans, and these Kenyans are the Kenyans that we call the frontline workers. So it consists of healthcare workers, the army, police force, and our teachers. Okay. And that's the first phase. And we'll be concentrating on this first phase for the next 6 months. These are the people who are interacting with people on a day-to-day, and therefore these are the people who, stand higher probabilities of transmitting COVID-19.
The second phase will target 5.1 million Kenyans who are over the age of 50, whilst the third will focus on 5.2 million Kenyans with chronic conditions. The vaccine task force has been put in place to not only deal with the regulation of the vaccines, but the implementation, facilitation and financing of the vaccines.
So there's a financing sort of committee that's dealing with that. They're also dealing with the logistics of the vaccine.
Right.
How are we going to move it across the country? How are we going to ensure that we actually do some vigilance in the country to ensure any, unwanted effects, any adverse effects from, getting a vaccine are identified and dealt with.
Kenya will use at least 2 mechanisms in the vaccination program: the Africa CDC and the COVAX initiative. Both seek to help African countries get COVID-19 vaccines, and Kenya is a member of both.
Through that facility, we have actually been able to negotiate to the price of $7.70, so $7.70 for the cost of 1 vaccine dose. Okay. So that's about 770 Kenya shillings if you use the exchange rate of 110. And so that applies for whatever vaccine candidate we get, be it the Pfizer, be it the Chadox, which is the AstraZeneca, be it Moderna, be it Sinovac. That's the agreement that we have under the Gavi COVAX facility.
The Ministry of Health says the government is set to put aside 43 billion Kenyan shillings to fund the vaccines initiative.
The reason why we have not begun vaccination is not because of resources. We actually have secured the money. We have the money. But the vaccine candidate doses are not yet available due to supply chain issues in terms of the different companies, and they'll be ready when they're ready. As we speak today, through the Gavi facility, we already have secured 19.7 billion of these resources. Those are available. The 23 billion will then perhaps be secured through our World Bank credit line, as well as exchequer financing for us to be able to cover that population, who we feel if we can get 40% of Kenyans in, then we should be, near herd immunity, particularly with collaboration from private sector to get the extra 20%.
Cabinet Secretary Mutahi Kagwe and President Uhuru Kenyatta are set to launch the national vaccine program soon. Anita Nkonge, NTV.